The goal of the hackathon is to let people who have these great ideas, and they may not necessarily have the opportunity or the time to be able to actually dedicate and focus some energy around trying things out and experimenting. We give them a space which gets them out of the day-to-day kind of tasks that they may be involved in, and allows them to have some 2 days of focused time where they can be heads down, working on an idea and trying some things out.
You can really take something you've been thinking about, maybe in the off time at work, and start to evolve that idea and light up some ideas that other people have as well.
This process is really unique because it allows you to make a lot of progress in a really short period of time. So for us, this takes what we've been working on in like 2 years of meetings with different teams and brainstorming, and moves us farther in 2 days than we were able to get in 2 years.
This really creates an environment where very diverse teams can come together, and this year we've even actually been able to include some of our patient families as well, which is just so amazing to see.
This is really the very first time that I'm being asked to be creative, to say, given your experiences, how would you have solved this problem? Being a part of the hackathon process is very different when you're a parent and you're not a part of the hospital system. Not having that barrier of, well, this is the current system, and so we're able to envision something completely new.
One of the greatest things about the hackathon is it enables us to really question what's possible. If you can dream it, you can try to build it, and everyone in the room is super jazzed to work with you on it.
People are connecting with those that they may not necessarily have contact with otherwise, and it really helps them even outside of the event itself.
Participating in this process has reminded me that there are, when you put your heads together with multiple other people, there are always things that you not only haven't tried yet, but also didn't know existed. And so for me, being able to just bring my piece, just talk about what the day-to-day work looks like, has allowed me to let go and let other people think through some of the solutions, and has felt a lot easier to kind of break down the problem into pieces.
During the last hackathon, we actually had 2 winners. Both of those ideas have been able to be implemented. So they're already delivering a lot of value to the organization. They've had a real impact in clinical care and have been able to actually really change some of our processes. So they've been able to achieve results.
One thing I think Seattle Children's does amazing at is bringing parents and kiddos in so that we can see how what we're doing is impacting them. And this is just another example of seeing ways that data and innovation can help kiddos and families.
I think it's so cool that Seattle Children's is doing this and investing their time in this hackathon, and to think outside the box. And it shows how much children's cares.
One of the core values of Seattle Children's is to encourage a great deal of curiosity, and we should be relentless with that curiosity, and this is very much an environment that really supports that.